When we're talking about knee issues, all kinds of people can get them. Athletic people, non-athletic people, older people, younger people, overweight people, super skinny people. Runners and women, especially, and women who are runners, I'm so sorry, are most likely to have knee pain. Women, because there's actually a whole bunch of reasons people are trying to come up with. We use our leg muscles differently. We have wider hips, which makes our knees, our femur bones hit the knee at a different angle. We have, like, our hormones change the texture of our ligaments and make them easier to tear. People aren't really clear on exactly why women have so damn many knee issues, but lucky us, we do, okay? The thing with knee issues is that for the most part, the knee is a hinge joint and it just wants to hinge. The screw home mechanism, it has a little bit of rotation to it, the knee, but it doesn't have a ton of rotation. It's not really what the knee likes to do. So when we make it rotate, when we collapse it in, when we collapse it out, when we turn and spin without attention to good mechanics, then what's gonna happen is any misalignment in our hip or in our foot and ankle is gonna go right through the knee. It's gonna make our knee want to turn, even though it really doesn't. It's gonna make our knee try to turn, shall I say, instead of actually turning. So, right, how to work with it. Strengthen the legs, especially the quads and the adductors. I personally have had really good results working the vastus medialis. There are several studies that kind of go back and forth in the vastus medialis. Some people say, oh, you know, this vastus medialis weakness is totally what's going on with knee pain. Some people say it's part of it, but it's not everything. I've not seen anybody say, do not exercise the vastus medialis, it will make knee pain worse. It might be less effective for some people, but for a lot of the people I personally work with, it has been extremely effective. So I'm going to show you a couple of things, how to do, a couple of ways to work with this. Before I do that, though, I'm going to not get distracted, and I'm going to say that when the other few things you can do for knee issues is that you can wear well-cushioned shoes. And I mean like important orthopedic type shoes, not like squishy and loose, because if you have like a really squishy insole or a squishy sole, you know, the MBTs or a lot of these balance shoes, if you already have bad hip and ankle mechanics, it can be a problem. If it's just weakness, it could help. It depends on the person. So observe very, very carefully when you're doing that. But well-cushioned shoes will help take the pounding off of that joint, which is fabulous. So, vastus medialis. Behold, I have a towel and some floor. So a towel or where's my stress brain? Something squishy. I'm gonna sit down on the ground with my leg out. I'm gonna do this knee, and I'm just going to squish down the towel. My heel is on the ground, squishing down the towel, squishing down the towel, squishing down the towel. Now the way I know this is working is that, here's my kneecap. I'm going inside and up just a bit, and I can feel my vastus medialis contracting as I press the back of my knee down on this towel, or on the squishy thing. I can also go to the gym and I can use the quadriceps extension machine. I usually do this with one leg. There we go. I usually do this with one leg, and I will just do this and extend, extend, and extend, keeping, again, here's my kneecap, up and in just a little bit. And I'll feel at the very end of that range of motion is where I get the most contraction. There we go. From that vastus medialis muscle. There we go, camera. So the reason that I would do that sitting down is because it's a very direct way of contacting the vastus medialis. It works in that last like 3 to 30 degrees of extension. So it's a good way to feel it start to jump onto your fingers. Then you can add a little bit more weight, doing that single leg quadriceps extension, and make that work.